So, joining together again for the session. Dr. Fakhra, gynecologist. Topic is pregnancy care after 3 months, and your questions will be answered in this session. So be with us, okay? So you ask how many doses of the tetanus toxoid that we have to take during pregnancy. Definitely, it's only 2 doses during pregnancy. That is recommendation of the National Health Scheme. But you can take Boostrix vaccinations as well as influenza vaccine that will prevent from the diphtheria and pertussis in the baby as early as possible, because these antibodies will transfer to the baby once they are born, and they are extra protected from it. Sometimes you ask, why so much of the swelling of my feet? Swelling of the feet is a common phenomena in pregnancy, but some of the conditions, it can be because of some medical problems also. We have to go for the evaluation to find whether you are anemic or not, whether you are hypoproteic, protein deficiency is there or not. Is there any problem in the kidney? Your blood pressure is high. All these conditions will lead to the swelling of limb. An individual assessment, evaluation and treatment is needed. If no cause is there, we ask, go for a walking, do some limb exercise, lower limb exercises that you can do while sitting on chair. You can do massage on your limbs, and walking is the most important thing that will decrease the swelling of the limb. The normal physiological swelling will decrease in the morning. That is very important sign. Doctor, I am having vaginal discharge. Look, a little bit of discharge is very normal during pregnancy. It is because of the hormone effect. But on the same time, you have to know whether it is infective or not. If the color of the discharge is yellow or curdy white, or it is causing you burning, irritations and pain, and you are disturbed with the discharge, definitely it is infective discharge, or it has some foul smell also. It is an infective discharge and we have to treat it. Why we should treat the discharges, doctor? Because it will cause rupture of membrane before time. This is very bad because you will deliver a preterm baby. It will cause preterm labor also. So we have to treat the vaginal discharge as early as possible. You have to maintain the vaginal hygiene. Stop using the outside lavatories because outside bathrooms cannot be clean, and it will introduce infections. And most important, the common problem that all of you are having is the constipation. Maybe because of less water intake, or because of the iron tablets, or your faulty food habits. So for constipation, we ask you have to take plenty of water, lots of fibers, inform vegetables and fruits. You have to take milk. On the same time, some laxative like isabgol husk, that is very good. That can be dissolved in water and taken at night after dinner. Constipation has to be released because otherwise you will have lots of problems like acidity, vomiting and dyspepsia, indigestions, and you won't like to eat food also. Doctor, please tell how much baby movement should be there, whether to know how my baby is doing inside. Definitely good baby have lots of movements so that you don't have to even count for it. But suppose you are having some problem, so minimum 15 to 20 times per day of the baby movement is enough. We ask you just lie down after breakfast, lunch and dinner and try to find out how much baby is moving. 5 to 10 movements each time is enough. Movement should be good, it should not be slow, and rolling movement should also be there. Slow movement, sluggish movement is indication that your baby is having some problem inside and you have to consult the doctor. You will consult the doctor only if you know that slow movement is not good for baby. So more or less we have discussed lots of conditions in pregnancy and troubles that arises in pregnancy. I hope you liked it. In the coming video we are going to discuss about the alarming signs, because once you know that these are the signs which are not good, then only you will consult the doctor. Early treatment is the best treatment. Prevention is the best modality to cure. So to prevent all the problems as much as possible, and be alert, be conscious, be aware of the troubles that is arising in pregnancy and get the consultation as early as possible. Do write in comments if any other queries you have, and so we can find the solutions for your troubles. Thank you so much and enjoy your pregnancy journey. Thank you.